Hello, this is Dr. David Greene, CEO of the Mid-Atlantic Pain Network. Today's topic is what you need to know about fibromyalgia. Fibromyalgia is a connective soft tissue disease involving chronic, spontaneous, and widespread musculoskeletal pain, as well as recurrent fatigue and sleep disturbance. It presents with multiple tender spots on the body that are primarily found on the back, neck, chest, hips, arms, and legs. Previously, it was referred to as a chronic pain syndrome, psychogenic rheumatism, and fibrositis. They all mean the same thing. So how common is it? 3.4% of women in the U.S. and 0.5% of men have fibromyalgia. So it's 7 times more common in women. Typical age range is 30 to 50. 3/4 of those who have it actually go undiagnosed. The American College of Rheumatology has put forth some guidelines, which are a history of several areas of aches or pains for a minimum of 3 months, having at least 11 of 18 locations on the body that are very tender, and if it's close but not quite fit the criteria, then it's called myofascial pain syndrome, but the treatment is the same. You can see from the front and the back where these painful tender points are around the buttock, the neck, shoulder, axillary area, elbow, and knees. Now, additionally, the Journal of American Medical Association put out some guidelines in 1987. Generalized and chronic aches and pains or stiffness for over 3 months in 3 or more anatomic areas. Once again, the tender points, and then no other identifiable condition that the symptoms could represent. And then they have these minor criteria, which include fatigue, headaches, neck and shoulder pain, sleep disturbances, bowel irritability, and subjective numbness and swelling. Oftentimes, it becomes a diagnosis of exclusion. A doctor will go through the rigmarole of looking for other more, traditional types of diagnoses, and if it just doesn't fit it, then it falls through into fibromyalgia. So what are the treatment options? Well, the Mayo Clinic proceedings years ago came out with some recommendations for alternative medicine for fibromyalgia, and that includes such modalities as acupuncture, chiropractic, physical therapy, massage, aromatherapy, homeopathic medicine, spa baths, relaxing herbals, music therapy, and yoga have all been shown to have benefit. Now, medication has been shown to be helpful as well. This may include antidepressant medications, nonsteroidal anti-inflammatories, muscle relaxers, Tylenol, opiate medications, membrane stabilizing drugs such as Lyrica, sleeping aids, and then a Myers cocktail IV infusion is a conglomeration of vitamins and minerals placed into an IV that are infused. There are some small studies showing that this works really, really well. So you can see there's quite a few medications listed here, but not every patient should get the same medication. Some just are not going to work as well as others. There are some FDA-approved medications. Lyrica was the first FDA-approved drug for specifically treating fibromyalgia. That was in 2007. A year later, Cymbalta was approved. A year after that, Savella was approved. The interesting thing is that we don't actually know how any of these medications works. So we just know that they did well in the FDA clinical trials, so they've been approved. How well did they work? There was a pilot study for Myers cocktail. Most of the patients experienced relief compared to baseline, but they didn't have enough patients to get statistically significant differences. There is no cure for fibromyalgia. It is challenging. New studies show that patients can decrease symptoms dramatically through multimodality treatment. So, one patient may do well with massage as well as acupuncture. Another may do well with, physical therapy and medications. It's just not going to be the same for every patient. The top non-operative pain management in the Mid-Atlantic region is through the Mid-Atlantic Pain Network. There are many clinics throughout the area accepting over 50 insurances and providing over 25 treatment options with the board-certified award-winning physicians. Visit us online at midatlanticpainnetwork.com and then call us for more information and scheduling at 855-444-6585. I'm Dr. David Greene with the Mid-Atlantic Pain Network. Your pain stops here.